put in, as well as my comments. I'll be glad to go through anything with any of you all. Would you agree most of you, I think, got full credit for the product? Well, pretty easy to squish together, right? So just remember, documentation still matters as we go forward to the last two dosage forms. And again, the good news is that today's lab is the shortest dosage form to prepare, but these last two I'm kind of always excited about, because I would argue a lot of you aren't going to maybe spend time in a compounding-only pharmacy, although some may get a chance. These last two things, though, are things that you're most likely to see in any retail setting, or any pharmacy that does any sort of compounding, even occasionally. It's most likely going to be a what? Either a suspension that we're doing today, or next week's cream oils. How many of you worked in a pharmacy where at some point they made a suspension, or even if they took a couple of creams and just mixed them together, right? So it's pretty common. So we want you to have some fundamental skills with that. So they're not hard dosage forms, that's the good news. You just want to make sure that you do them well. So again, we'll do some real interesting ones. So let's talk about suspensions. They're not hard to make, but there's something to it. So let's start with this though. Let me ask you this. If you look on the definition, suspension, it's a liquid preparation. That's exciting. That contains drug. But what is the difference between a solution and a suspension? Can you tell me what fundamentally is different between a solution, which is a liquid with drug, and a suspension, which is a liquid and drug? And don't tell me what they did yesterday where it's spelled differently. I know that. What else is different between the two? How would you describe the difference? But not dissolved. So I guess the question is, and you're absolutely right, I mean, when it dissolves, it separates at a molecular level. So again, do you see, are solutions clear or are they cloudy? They're clear because the drug is completely dissociated from each other, and they're completely dispersed in that liquid. Whereas powder is still not soluble, and therefore you have the powder and the drug that still kind of clumps together and will not dissolve into it. So do you want one ginormous clump of drug? No, right? We want to break it down into as fine of little particles, kind of like what we talked about with emulsion. So you're absolutely right. So that brings up these compounding goals. If we're not careful, since this drug won't dissolve in the solution, we want it dispersed. How do we break the powder apart? Just like how did we get the oil to disperse within the water? We added what? Emulsifiers. In this sense, we're not adding emulsifiers. We've got to do other things to get our powder to pull away from itself and disperse within there. So the first thing you're going to want to make sure you do is, and today, your wet lab, you're going to have some tablets. What do you need to do with that tablet? You need to crush them up as fine as possible. If there are bigger chunks than smaller chunks, then your suspension won't be uniform in its concentration. One dose might have 5 milligrams, the next dose might have 10 milligrams. There is a bigger chunk of drug floating in there. So it's really, really important to start with as fine a powder as possible. All right. Well, that's the trituration thing. The most important thing, even from you guys today, from a practical sense, most of you, because we just did this with the P1s, and almost everyone did it right, but there was like 3 or 4 people shake it up, and there's like this ginormous chunk floating around in there. And it wasn't because they didn't grind it enough. That is important, but they didn't wet it properly. So that word, remember, are you already sick to death of triturate? Okay, and geometric dilution, right? So another key term, though, for your procedure, and it's really important today, is wetting the powder. And I'll talk about what that means here, is essentially, I always try to do an analogy. I don't know if it works or not. Have you ever taken a glass of milk, tried to make chocolate milk with the powder? You take this milk and you scoop some of the powder up and you put the powder in the top of the milk and then you stir it, and what does it do? It just all clumps together and floats around at the top. You can't stir the powder and make it just disperse in the liquid. So what you really need to do next time you make chocolate milk is put the powder in your mortar first, and then put a little bit of milk in there, and then really force that powder into the milk, okay? Then get a little more milk and force it in there a little bit more. And what you do is you displace the air from the powder and replace it with the liquid. And that way, the powders won't clump together. You really do have to force it. So the point of wetting is you start with very small amounts of liquid, get all of that liquid dispersed in the powder, and then add a little more liquid to the powder until eventually it goes from a powder to a paste to a slurry, sludgy thing into a liquid. And you need to go through those phases slowly. Or if you just dump all your liquid at once and you start to stir, the powder clumps together and then floats around. And then you take your porter and you can try to kill it, but it will just slide away from you. You can't break up chunks once there's enough liquid to float around. So the wetting is key to making your suspensions. Having said that, we need to also increase the viscosity, because why can't you make a suspension? You could even wet a suspension with water and shake it up really good. It would disperse, and then what would it do? Come right back down, right? So they're insoluble. What will gravity do to them over time? Pull them back down. So we want to slow the sedimentation rate. How can we slow it down? Instead of using water, we can increase water's viscosity. So make it thicker so that it has to fight against gravity to be able to go down. So the viscosity will keep it suspended longer. Does it have to be, do suspensions have to be as thick as like honey? No, so think about that. How long, when you shake something, how long does it need to stay suspended? An hour? 2 hours? 5 minutes? Enough, couple of minutes, long enough for them to prepare a dose. But you agree you need to shake it really good and then take the cap off. Oh, where's the spoon? Go get the spoon or the syringe. Go get it and prepare it. So a couple of minutes is usually enough to be able to prepare a dose appropriately. Because it used to be before, and you guys got it easy here. We're going to be able to use these commercial products here in a minute. But in lab, not that long ago, before those were readily available, we made a 1% methyl cellulose. Were any of you desperate enough to listen to the podcast? Didn't think so. Anyway, so when we talk about that, it was a real pain. It was really difficult to make, but methyl cellulose makes a really thick, viscous suspension, and that stuff, you shook it up really good, it would last for hours. But we don't need that, okay? So what you're going to see today, your suspension isn't going to be thick and gooey, if you will, like a milkshake, but it's going to be thick enough. You'll see the suspending agent you're going to use imparts enough viscosity to keep those particles dispensed for at least 5 minutes, which is more than enough to prepare a dose. More importantly, what these do a better job with than the methylcellulose did was flocculation. What the heck is that? Use that in conversations if you get slapped. Anyway, so a highly flocculated system is one that, once it all settles, what do you have to do before the next dose? Shake it up again, and you want it to be able to re-shake up and resuspend very easily. The thicker or the higher the viscosity of the suspension, the harder it is to get everything shaken up again. So it does a real good job of being able to become resuspended. So those are all the things that we're going to want in your final product, and using the systems we have that'll work. All right, you're on notice. These are easy to make, but there's two things. There are two methods of preparing suspensions. One that we've called the exact method, and one that's called the excess method. I'm telling you now, on the exam, you may have noticed this in your packet, I will tell you which method you have to use. It is not your choice, okay? So you can't just say, I understand this one, and I'm not going to even worry about the other one, because I will tell you which method to use, which means your calculations and procedure has to match that method. You won't get credit for anything else. So just make sure you can do either one of these, all right? Why are there two methods? Well, the excess method is the one we're going to do up here with the dry lab, and that's me. And so what's a good word to describe me as a pharmacist? Lazy, okay? I'm lazy. I don't like to do a lot of work, okay? So what I'm going to do with the excess method is the shortest, quickest procedure. It's the easiest procedure, okay? Because I'm going to use an exact number of tablet or capsule. I'm not going to have to crush anything up, or I'm not going to have to weigh out a certain amount to get an exact amount. I'm going to make sure I make as much suspension as I need to use an even tablet or capsule. All right, that takes me longer in my calculations, but I'm good on calculations. So spending a little more with calculations means I have to do a lot less work. Okay, so here's the effort on this. Here's the key concept of the excess method. If the doctor says to dispense 90 mils, how much do I have to dispense? 90 mils. How much can I make? Anything more than 90 mils, right? I can't make 80. That's not going to work. But can I make 100 or 120? And just dispense the amount that the doctor requires? And that's the key to the excess method. You make excess. You don't just make what the doctor prescribes. You make excess, but you only dispense the prescribed amount. So, well, there are only two exceptions or kinds of drugs where you wouldn't want to use the excess method, where you're going to be preparing more than you need and having to discard that. So what are some examples? Controlled substances, absolutely, because you can't just discard the controlled substance. You have to put it in the bottle and document it and send it back. That would be a big pain. So I wouldn't do this with controlled substances. And what other type of drugs? One of them that costs $200 or $300 a tablet. You realize how expensive some of your drugs are, right? So if I use extra tablets and capsules to make my life easy, but I end up washing away basically $300 worth of drugs, am I making any money on that prescription? No. So very expensive drugs and controlled substances you wouldn't use the excess method with. But what we're doing up today, like botanical, oh, that's dirt cheap. That's so cheap, it's not worth my time. See what I'm saying? So the time I save is worth more than the little bit that I'm going to discard here in terms of drug. The exact method that you're doing in your wet lab today is exactly that. You're going to see exactly how much drug the patient needs for exactly the volume that the doctor prescribed, and that's what you're going to prepare. You're not going to do any excess. So procedurally, it takes you a little bit longer when you do that method. So anyways, let's just practice it. Turn to your dry lab. And again, I will say, make sure you do these calculations and keep up with me, because this is part of what could very well be the method you have to do on the exam. So, reading and interpreting this, pretty straightforward. Bothanicol is the drug. The concentration, be careful, always be careful with your interpretation on the exam. It's 7.5 milligrams per what? Per 5 mLs. Can you express concentrations all sorts of different ways? per mil, per 5 mils, per teaspoonful, tablespoonful, something like that. So always take the time to be careful with your interpretation of the concentration. All right. The doctor wants us to dispense 80 milliliters of that suspension. Now, does bethanechol already come as a liquid? Maybe you don't know off the top of your head. You could look that up. Would we ever compound a suspension for a drug that's already available as a liquid? No. I mean, not generally. We're not trying to compound anything that already exists, but it only comes as a capsule. And so our source of active ingredient are 50 milligram bethanechol capsules. So really, this doesn't exist. Why would you ever need to do this? Well, maybe the patient can't swallow the capsule. Maybe the dose isn't available in a kind of pre-made form, so it may be easier. Instead of making capsules, could you make a 7.5 milligram capsule? You could. I mean, there's no reason you guys now know that skill. You could actually make this as a capsule if that was the only way you wanted to provide it, but if for whatever reason, we want this dose to be able to be given as a liquid, possibly due to a thing. So go ahead and write down this information. Again, I'll remind you the formulation isn't something you have to fill out on the exam, but it is something you do in practice. Did you all know what bethanechol is? You know what kind of drug it is? A cholinergic mimetic, so obviously something that stimulates the parasympathetics, muscarinic receptor, so either something for GI or maybe urinary issues, so one of those reasons they need to have this medicine, but they need it in a liquid form. Okay? So, enter the additional information. I'll remind you, I tell you what the source of the drug is, but I also say apply which method? The excess method. So on the exam, again, that's where I will tell you which method to use. So let's do it. Let's start by looking at the ingredients, just to remind ourselves before we do our calculations and our formulation here, what are we using? We have bethanechol, 50 milligram capsules. All right, that's pretty straightforward. And then we have Aura Blend. So before we just jump into that, let's make sure you know which one of these bottles it is. Because here's the good news and the bad news. Good news is you don't have to make your suspending agent. You don't have to make your flavoring vehicle. That's why this is a fast lab. You just pour it out. All right? But let me ask you, do you know the difference between Aura Plus, Aura Sweet, Aura Blend? Would you have grabbed the right bottle? Okay? Because oftentimes, if you look at your wet lab script, or even on this script, it didn't tell you which one to use, right? I made the decision to use Aura Blend. Okay? My point being is, on the exam, I have the right. I'm going to go through these 6 bottles. I'm going to put out on the exam a random assortment of any of those 6 bottles. Your only task is to make sure you use the right bottles in the right combinations. I want to make sure I explain what that is here. Because 3 of these all start with the word aura. A little confusing. So let's start with Aura Plus. I'm holding you to know what Aura Plus is. Anyone tell me what Aura Plus is? It's a suspending agent. It is 100% suspending agent. It is a commercially prepared suspending agent. Right? So, would this suspend your drug? Yeah. So, can you just use all 100 mils as Aura Plus? Physically make it that way, but do you know what the problem with Aura Plus is? Has anyone ever tasted? It tastes blah. And it's not like terrible, but it's blah. It's just, you'll see this is white milky blah. It doesn't taste very good. So, that's not very good. So, what does the manufacturer say to use their product? That's what I'm just saying. So, and again, this is a little bit in the podcast. For me, to use a commercial suspending agent and flavoring vehicles, they're mixed in a manufacturer recommended ratio of what? 1 to 1. A hard one, I'm not trying to make it difficult, it's 1 to 1. So if you're making, I'll say 100 milliliters, how much would you do of the Aura Plus? 50 milliliters, and the other half would be something that's not bad, it would be, okay, so outside of this, if we use this to suspend the drug, what are we going to use to make it flavorful? So they make a product called Aura Sweet. Okay? That's just the same company's version of a flavoring vehicle. When I say flavoring vehicle, it imparts sweetness. Okay? Sometimes they impart a certain smell to it. Oftentimes they impart a flavor. Okay? The only problem with Aura Sweet is, what do you think flavor is sweet? Is that a flavor? It is sugary, it is sweet, but it doesn't have a distinct flavor. The best I could do is call it kind of fruity, but it's not like it's a cherry or a banana or a grape. It's just, it tastes okay, but it doesn't taste like anything. So the one that's close to that you just need to be aware of, if I put out simple syrup is, again, a syrupy, sweet flavoring, but not imparting a specific flavor. Okay? So these are 2 that make it palatable, but not flavored. Okay? If you want to impart a specific flavor, you would use something like cherry syrup. So what do you think cherry syrup tastes like? My favorite, by the way, if that was on the test, just so you know. But anyway, I love cherry syrup because it's sweet and it's cherry, man. It tastes like cherry. Okay? Serpalta is something very similar. Don't ask me where the name came from, but it's grape. So if you wanted a grape flavor that's sweet and tastes like grape, you would use Serpalta. So Would you agree? You have a couple of things you could use to not only sweeten it, but to give it a flavor. There are a couple of things, especially the Aura Sweet, which is what you're using today, so you'll see and kind of smell what it's like today, that definitely would make it flavorful, but not necessarily to a specific flavor. Why would you not want to give it a specific flavor? Well, does everyone like cherry, or does everyone like grape? Not always. And sometimes certain drugs are more bitter and are masked differently with different flavors. But more importantly, I always think of this with my daughter. She grew up with having to take Zyrtec for allergies. And Zyrtec is grape flavor. And guess what she now hates? Anything grape flavor, because it reminds her of medicine. So she associated the two together. So sometimes people are real sensitive about flavors. You may want to just go with something sweet. But again, if they prefer a flavor, it'll be much more palatable if it's something that they do like. So anyways, going back to that. Regardless of which flavoring vehicle, you don't drop on the floor, you mix it with a 1 part of flavoring vehicle to what? 1 part of Aura Plus. Aura Plus plus any of the other flavoring vehicles. What is the one we're using up here, though? What does it say? Aura Blend. It's not the only one I haven't talked about yet. What do you think Aura Blend is? Knowing that Aura people make the Aura Plus suspending agent and the Aura Sweet flavoring vehicle, what do you think the Aura Blend is? A pre-mixed version. So this already contains a half a volume of suspending agent with a half a volume of the Aura Sweet. So what do I use this 1-to-1 with? Don't use this 1-to-1. This is just used purely as it is, because as I pour out every volume of this, it's already half suspending agent, half flavoring vehicle. So I chose this one because what kind of pharmacist am I? And how many bottles do I want to have to go get from the shelf? There's 1. So all I have to do is go get this 1 bottle, 1 and done. All right. So it makes it easier. So you certainly can have to do that. However, could I choose a different flavor of Aura Blend? No, it's just Aura Blend. You get what you get. So again, if you wanted to be able to make different combinations, that's where the plus goes. So over now, what goes wrong on the test? People use all Aura Plus, thinking it's Aura Blend. Do you agree? That's not good. What about this? Can you mix essentially Aura Sweet with Serpalta? Well, those are 2 what? Flavoring vehicles. Can you do 1 part Aura Plus with 1 part Aura Blend? No, because now you've got essentially only 25% flavoring vehicle. Or reversely, Aura Blend with a flavoring vehicle, then you only have 25% sweet or suspending agent. Are you with me on that? It's the combinations of bottles. I don't want to make it harder than it is, but I have the right now of any of these 6 bottles to stick out there, and some of you will choose the wrong combinations because you weren't listening to me or whatever reason. So just be careful. Make sure you know what the bottles are. All right? And that's it with that. All right, so we're going to use Aura Blend because it is the easiest one to use. Let's go ahead and assign our Beyond Use dates. We've got our ingredients up here, so circle the one with the shortest Beyond Use date. So between the botanical and the Aura Blend, which one is the shortest? 6 of 2019. So how many months is that from now? That's basically 2 months. Is that less than 6 months? But yeah, but does that matter? Is it? But is that? So is it 1 month? 2 months with the Beyond Use date? 14 days. Yay for you. 14 days. The most conservative any of our dosage forms. Why is that? Why do we only put 14 days on it? It's got water, and what does water do? It does 2 things. It can break down the drug. It could cause hydrolysis. We have no idea how stable our drug is in water. It started as a powder, which is stable, but you put something in water, you have no idea how quickly it's going to break down. So we don't know if it's going to be stable. And more importantly, water can promote bacterial growth. So now it's not only 14 days, it's 14 days under what? Storage, refrigeration. So you can write that under. We'll talk a little more about storage in a minute, but definitely it's 14-day Beyond Use date. So can you just write 14 days? No. So what is 14 days from today? This is a tricky one because it goes into a different month. 30, 31, May 2nd. Very good. May 2nd of 2019 would be your Beyond Use date, 14 days from today. All right. Good job. Let's do some calculations, man. Favorite part. Let's do it. Get your calculators out. Don't just wait for me to do it. I can do it, and I'm not even taking the test. So it's your job that you can do it. All right? So looking at the prescription, the first thing I think you want to try to calculate is the total amount of botanical. If we're going to make 80 mils of a suspension that has a concentration of 7.5 milligrams per 5 mLs, how much total botanical do we need? So set this up however you want. I'll do it my way. You certainly don't have to do it this way, but I would start with my concentration, which is 7.5 milligrams per what? Per 5 milliliters. Set that equal to, well, I don't know how much drug, but do we know how much we're going to have to dispense? Milliliters. Go ahead and solve that and tell me how many milligrams of bothanicol do we need? How many you drawing it? All right, it's too nice outside to work. All right, 100, and did you get 120 milligrams?
Yes.
And I know this isn't hard. So do the same thing we've done for your tablets and capsules and all those things. How many bothanicol capsules do we need to use to get 120 milligrams? What are the strength of our capsules? We said they are 50 milligrams. So if I divide that by 50 milligrams per cap, I would get 2.4. And now this is different. You can say, well, clearly then I would need to get 3. But if I use 3, am I getting 120 milligrams? No, I'm getting more than I need. But here's the deal. Could you do this? Could you go get 3 capsules? Get the weight of the contents of those 3 capsules. Set up a proportion and tell me exactly how much powder provides 120 milligrams. Thank God, we did that all semester. Good, yay. I'm too lazy to do that. I don't want to do that, okay? Because do I have to just make 80 mils? I could make more, I can make any amount more, so here's what I'm thinking. I'm going to try to come up with a volume to make so that I can use an even number of capsules. Instead of having to do that whole proportion-y thing, let's just do more than this. So give me a capsules number that's more than 2.4. I agree. Let's try 4. So I like even numbers, right? I mean, let's go with 4. Bear with me on this because I'm telling you, why do you like 3 better than 4? Well, don't work ahead of me. Anyways, there we go. Let's try this because you don't always know what's going to work and what's not going to work. Are you with me on that? But the whole point of this method is let's now go ahead and choose a unit of the tablet or capsule we're using as a whole number and work back to see what volume we would need. So if I were to choose 4 caps, how would I figure out what I'm doing? We want the same concentration, which is 7.5 milligrams per 5 mLs. Right? How much bothanicol would be in 4 50 milligram capsules? 200, right? So now I can put in the top. I know I'm getting 200 milligrams. And what I'm going to solve for is the bottom that tells me what volume I would need to put 200 milligrams in to get a concentration of 7.5 per 5. So humor me here, come up with this volume. Because this works. There is no reason why I can't make this. And use my 4 capsules and not dissolve, but disperse it in what volume? 133 milliliters. Did you guys get 133? Would that work? Yes, but is that a convenient number? No, and I'm not even sure I could measure that very accurately with my conical, so I'm still not happy with it, so I'll break down and try your 3. All right, let's try your 3 capsules. Let's try 3. If I did try 3 capsules, do the same thing, 7.5 milligrams per 5 milliliters equals now 3 capsules would have how much? 150 milligrams over X. Now when I solve for X, what volume would I have to put my 3 capsules worth in to get the 7.5 milligrams per 5 ml? I think that comes out to 100 milliliters, and that seems easy to me. Okay, so with a little bit of time and effort with my math, I now know that I'm going to, and this is what I mean by this is the easiest way. If I got that script, all I have to do now is go get 3 capsules. I choose the or blend, which is just 1 bottle, 3 capsules or a blend, mix it all up, and I'm done. Okay, so assuming I do correct techniques like Judy's going to show you here in a minute. Okay, so let's go ahead and fill out our compounding record. So go back to here. How many capsules did we say we're going to use? 3 caps. And what is our volume for or a blend? 100 milliliters. All there is to make this thing. So we have all of our amounts on there. So Judy will come up and let me get my stuff switched over.
Okay, so I am one of those lazy pharmacists. Doesn't have a lot of time. So therefore we're going to use the access method, and we're going to use oral blend as well. All right, so watch me as you guys see that. Take this into my layout here on the bench. This is the one lab you're going to see a lot of drug on your rubber spatula as well as on your pestle as well. Therefore, this is really a lab you do not want to just lay them on the bench. You're going to lose drug. Therefore, you want to hand them on the weigh boat really well. All right, that's one thing. So we need 3 capsules. Do I need to measure the weight of the capsule powder for this, Lucifer?
Wait a minute, why not? You did when we made capsules. Why don't we need the weight of them here? Even though we used an even 3 capsules sometimes. How do we dose capsules? They're dosed on weight, right? Didn't we weigh your capsules at the end? How do we dose suspensions? volume. We dose them on volume. So we don't worry about the weight of that powder. But here, and I don't interrupt Judy, but this is an important thing. When we add the powder to our liquid, will it occupy a certain volume? Will it displace a certain volume? Do we need to consider that? The answer is no. From a practical thing, and you'll see that today with your own, the displacement of that powder is so small or insignificant it will not influence anything. Trust me, by the time you're all done, without even taking it into consideration, you'll probably have less volume than you thought you had due to loss on the mortar and loss in your graduate and everything else. So if it's a ton of powder, then yes, it might, but nothing you're going to do for me is enough, and most of the times you do not have to worry about the volume of the powder, which is, thank God, better than your suppositories. Remember how we had to do that density displacement thing? We don't have to worry about that for suspension, so that's the good news.
Okay, all right, so now you know that why we don't need to know the weight of the powder. I'm going to use oral blend. Okay, so watch me before I open up. Make sure you shake really well. Of course, make sure the lid is on first, okay, before you shake. All right, so I'm going to measure 100 ml. By the way, what is this? What am I using? Conical. Great, that's a difference, right? P1 also has a cylinder.
Why the conical over the cylinder, though? She's doing it. Which one is taller? The cylinder, because it's more narrow. Would you agree? The more narrow, the taller it's going to be to get that volume. So when you go to pour out your viscous liquid, what's it going to do? It's going to stick along that whole length of that glassware, and you'll lose even more. So the conicals are fatter, so they aren't as tall, so there isn't as much loss.
Okay, all right, so I'm ready to do the procedure.
Stop 1 second,
Okay.
because I want you to, thank you. So this is the point. Go to step 3 and circle the first word. What is the first word? Wet. I want to make sure that you understand. Now, this is, what Judy's going to do here, the most important step in terms of making a good suspension is correctly wetting the powder.
Okay, so you're going to make a little dip. Okay, add a small amount, in this case, oral blend, and then titrate. Okay, this wetting procedure, your goal is to make a paste. All right, and you want to make sure that every little particle is surrounded by the suspending reagent, in this case, oral blend. Okay, and using your rubber spatula to clean off from the side. Also use your rubber spatula to gather them together on the very bottom. I have made a paste. Okay, at this point, the paste is, relatively speaking, still thick. All right, so I want to add 1-to-1 ratio. How do you describe that 1-to-1 ratio? What does that mean? Oh, you heard that term? Great. Okay, 1-to-1 ratio. I want to continue titration. Okay, so that paste look definitely more loose now. Okay, and again, I want to gather them together. Okay, that look like a very well paste formed already. Now I can add more. Did you see that? Have I ever set my pesto somewhere on the bench? No, so always hold on to it using your non-dominant hand and when you don't need it.
Because there'll be a lot stuck to the pesto in the beginning when it's a real thick, sludgy paste. But does it begin to thin out? And as it thins out, it will pull all of that stuff off the pestle. So again, you don't want to have left it on the countertop or somewhere else.
And not only your rubber spatula can help you do the scraping here, your pesto can come back to scrape something off from your rubber spatula as well. Especially, you will have more drugs than I do, and you probably will have a lot of drugs stuck on the rubber spatula. So they can help each other and rinse with each other. All right, so I probably need to add about 2 more additions. Okay, and boom, did I just add 1 addition, right? Everybody saw that? Okay, so here comes the last addition. Okay, all right, so this is the last addition.
So while she's finishing that up, because we don't want to mix it, go ahead and circle the number 4 and draw a line, a little arrow out here. I want to make sure you understand step 4. This is important. This is unique to the excess method. This is going to be very different than what you're going to do with the exact method. Step 4 said to continue to add, how much of the oil blend did we end up adding over that whole step? All of it. Remember, without putting anything into the dispensing bottle, we stuck in the mortar and we continued to add and add and add until all of the drug and all of the suspending and flavoring vehicle essentially is added in the mortar.
Okay, so we are ready to transfer into a, what is this?
Dispensing bottle won't cut it. We'll talk about our thing here. Let's go ahead and talk about
Okay.
what, prescription bottles. Are they normally amber or are they clear? Why are they amber and not clear? Light resistance. So we'll talk about the storage here in a little bit. You do need to use a prescription bottle, but you're going to have to describe that, meaning that a prescription bottle means that it is light resistant. So.
All right, so I'm ready to transfer. That's why I was continue trading here, because before you transfer, make sure that it's uniform. So I want to transfer really well and ready to transfer. And technically, you do not really need to set the pastel on the bench to do the transfer. You can mix and then transfer. Use your thumb to stabilize the pastel, just like this. Well, guess what? My thumb is not long enough. Okay, so if you have a tiny hand just like what I have, it's okay to set on the side. Right, and should I transfer everything? How much should I transfer? Okay, thank you. I almost transfer everything. That is the most common mistake when you do with access method. All right, so I finished making my suspension.
How did she know how much to pour it to? Did she use a graduated cylinder?
No.
Can you measure in the bottle itself? As long as you go to an exact marking. You can't estimate between two markings, but if 80 mils has a notch, or an 80, between a 70 and a 90, there's a specific notch there, you can certainly use it to measure.
Okay, so I made it my product. I made it probably in the morning, early morning, when nobody was there. And then my patient came in the afternoon and is ready to pick it up. Can I just dispense as it is? What do I need to do before I dispense? Shake well. All right, so pretend I dispense.
Don't pour it out yet. So everyone turn to your so it's ready to go. Would you agree it's ready to go here? So turn to your QA section. You're going to fill out the QA section. So what does the first part of the QA say? The product weight or volume. So we're going to do volume. So Judy, before you pour anything out, do a double check here and tell us exactly what the volume is.
It's 80 mil.
We did verify that it's 80 mils, so document 80 mils.
Right. And I just shaked, and let's pour some out.
So now we have to do our product description, okay? And for us, we're kind of crazy, right? So it's going to be kind of long. What color is that? Off-white, beige, I don't know. Pick a fancy word for off-white. I don't care, but off-white. So it's off-white, so we describe the color. What comes next? You're going to be doing the Aura Sweet today, and it smells just the same. So I want you to try to describe it in your own words. I said this doesn't have a flavor, right? And it does smell, and the best I could come up with is fruity smelling. Or you could call it sweet. Really, you'll see this here in a little bit when you try it yourself. Smell it and see what it smells, but you can't just say sweet. You need to call it sweet smelling or sweet odor. So again, either fruity smelling or sweet smelling. So it's off-white, sweet smelling. Is that clear? So how would you describe it? Opaque. I like opaque or cloudy. I could live with either of those, but opaque's a good word. So we have off-white, fruity smelling, opaque, viscous. Okay, and now not highly viscous, but this is thicker than water, so we're going to call it viscous because of the suspending agent in there. Suspension. We're still not quite done. So off-white, fruity smelling, opaque, viscous suspension. Are there any visible clumps in there? Because we're going to talk about the biggest thing. Remember how we said the whole point of the wetting the powder was to avoid what? The powder clumps. So I would say after suspension, say with no visible clumps and easily redispersible. That's describing the suspension with all of the properties we described on the first slide. So it should say off-white, fruity smelling, opaque, viscous suspension with no visible clumps and easily redispersible. Rolls right off the tongue, right? And you're going to have to remember that for the test, kind of. So you're just going to be aware of that. So we want to make sure you have all of those steps down. Now, let's see here. Let me go ahead and put this back up. All right. As Judy mentioned, in terms of this method particularly, the two main for any suspension you make for me, the two main reasons you'll mess up and not get full credit for your product is failure to wet appropriately, meaning that you added the liquid too soon, and therefore there are visible clumps. Remember how I said there were no visible clumps? And we're going to look on your final product. If there were visible clumps, it's because you didn't triturate and probably did not wet the powder. You wet it too quickly. You can't go too slow. You really can't add too small an amount, other if you're still here 3 hours later. But you can't add too fast, so go slow when you do that. And for the excess method, it's what Judy was said at the end, it's pouring out and dispensing all of it. You're so proud of what you made. Don't give me all of it in the excess method, right? Just give me the amount prescribed. Make sure you're careful with that. All right. So the rest of the documentation to get past this one, we did the QA stuff, we did the beyond use stating. Container closure system is kind of important. Describe this as a 3-ounce bottle. Okay, so that's good. You guys are making, do you know what volume you're doing in the wet lab? You remember? 60 milliliters is what you're dispensing. How many ounces is 60 mils? 2 ounces. So would you go ahead and dispense it in a 2-ounce bottle? No. You need to understand you must use an oversized bottle. A 2-ounce bottle, if you've never seen it, the ounce mark is right on the neck. It doesn't leave very much room for shaking. So you want to make sure the bottle has enough room that even from the first dose that there's plenty of room to shake in there. Now this is a 3-ounce bottle, but we're only dispensing how many mils? 80 mils. So that gives enough room on top to be able, that is essentially oversized. So we're good there. For you guys today, you would not want to dispense your 60 mils in a 2-ounce bottle. You would want to choose a size larger than that. So be aware of that. Okay, so what I meant with storage conditions, there are 2 things, not line reading. You already talked about the one, refrigerate. Make sure you have refrigerate down there. And then also that it's a light resistant container. You must store this in the refrigerator in a light resistant, or if you want to call it an amber container, that's fine. Amber, light resistant means the same thing, but you cannot say prescription bottle, because that doesn't convey to me the knowledge that you need to have that you're storing it in a light resistant container. All right? So, all right, there's that. Drug name is pretty straightforward. It's drug name, then the strength. I will warn you about the strength. You can just look at the way it's expressed on the prescription, but concentrations can be expressed multiple ways. Milligrams per mil, milligrams per 5 mils, milligrams per 15 mils. There isn't rights and wrongs unless you mess up usually the mil part, that you misexpress it. You know what I'd get a lot on the test on this one would be 7.5 milligrams per mil. And it's not. It's 7.5 milligrams per what? Per 5 mils. So just be careful with the number there. And then the most common mistake I know some of you are going to make, that's not a suspension. Okay, it's what kind of suspension? An oral suspension. And that is what you're going to be making on the exam, is an oral suspension, the same thing you're doing today. But aren't there other, can you compound other forms of suspensions? Are there ophthalmic suspensions? Are there topical suspensions, which is essentially what a lotion is? There's rectal suspensions, kind of enemas that you make. So it needs to say oral suspension because that is the route that you're going to be administering that. And the 2 auxiliary stickers, just memorize them. They should make sense. Is keep in the refrigerator and shake well. Clearly you're going to need shake well every time, and this needs to be stored in the refrigerator. So those will be the 2 stickers I'm going to grade for. Okay. Any questions on that? Not that hard. All right, so let's look at your wet lab real quick. We're not going to do the calculations together. I just want to preface a couple of things before you turn you loose out there. If you'll notice, here's this kind of an interesting suspension because it's a unique combination that's not otherwise commercially available. So you're going to be combining some allopurinol at 180 milligrams per 5 ml with some hydrochlorothiazide, 12.5 milligrams per 5 ml. And you're going to compound and dispense exactly 60 mils because in the additional information I tell you, you must use the exact method. All right? Enough said that. I don't have to go into that a whole lot. When you do your calculations there, I'll give you a warning. The reason that these are a little bit tricky is that you have to use commercial products for both the allopurinol and the hydrochlorothiazide. We have allopurinol 300 milligram tablets, and we have hydrochlorothiazide 50 milligram capsules. So that's your source of active ingredient. So you're going to have to take that into account when you calculate your numbers and your amounts here. Let me ask you this, a couple of things for the allopurinol. It turns out that it's not an even number of tablets or capsules. You're going to have to weigh, or you're going to have to use more than you need, crush it up, and then extract only the amount of that powder you need. Very similar to what we've done in the past. So I'll make your life a little bit easy. Do tablets weigh the same whether they're whole or they're crushed up? They weigh the same, so you can just stick the tablets on there and get the weight. It may be easier, and then you don't lose anything, all right? But even once you have that weight, you need that weight because you're going to have to set up the proportion to figure out how much powder you need. The good news is the hydrochlorothiazide capsules will come out to an even number, so you can just use that number of capsules. So that one's a little bit more straightforward, okay? So you've got some calculations there. You can't do that, though, can't complete them until you do get the weight of the allopurinol tablets you need. That is part of it, okay? So do your calculations on your own or help each other, but I have posted my answer keys on the supply stations in the middle. So over there by the sinks in the middle, you can double check your answer keys. They won't be exactly the same because my weight of allopurinol won't be exactly your weight of allopurinol, but it should be close. Please ask us if you have any questions about the calculations. Making these things don't take long, so make sure there's no reason to walk out of here unclear on how to do these calculations. So take the time to make sure you're confident on that, all right? So you'll do that. As far as the procedure goes, the only thing I want to kind of tell you about is What you're using is the combination of Aura Plus with Aura Sweet. Those bottles are at your stations at the raised area between you and the person across from you, kind of like your suppository stuff was. So be kind and share or whatever. What should you do? One of those you should shake up first. Which one? The suspending agent. Which one was the suspending agent? The Aura Plus. So make sure you shake that up really good, like Judy said, with the cap on it really well. Okay? And then you'll measure all this stuff out. Let me ask you this on the procedure, because some of you can just follow my procedure, but let me ask you this. You're going to put all of your powder in the end in the mortar, and then you're going to wet the powder. Should you wet it with the Aura Plus or the Aura Sweet, or does it even matter? Because they're both liquid. It matters. And which one? Aura Plus, not because it's Aura Plus, because it's the what? The suspending agent, which means it has the higher viscosity. You want to wet your powder with the higher viscosity. Remember, we just did Aura Blend because it was a combined thing that had it. But if you're doing two separate ingredients like today, you always wet the powder initially with that. All right? All right, and follow the rest of the procedure. It's pretty straightforward. The bottles, there are, your light-resistant containers are at each of the 3 stations, but only on the near side, kind of on the closer side, so don't freak out. Just go to the other side of the bench if you can't find your bottles there, and you'll make your product. I will tell you, wet the powder carefully. One term that we didn't do, can anyone tell me, hopefully you watched the video on how to prepare this. There's one thing that you're going to have to do now that I didn't do in the excess method. What is the key difference between the excess method and the exact method? One word is rinsing or washing. So make sure you understand that you're going to follow through. Just read the procedures. You're having a very important step of rinsing. And why do you think I chose allopurinol 300 milligram tablets? You know what color they are? You saw in the video, hopefully? A bright orange. So you'll be able to visualize how good a job you do at rinsing and getting all of that drug. Because you're starting with exactly the amount of drug you need in the mortar, which means you got to get it all out of there. So that's the point of the rinsing. All right. Beyond that, when you're all done, and this won't take you that long, make sure you have your final product. Make sure you have completed all your documentation, either on paper or on your iPad, whatever it is, but make sure you filled out all of the sections, and just bring your product and your iPad/paper up to the here. We'll bring you over in groups, and we will go through how we would QA it. We're going to speed things up a little bit since you all finish about the same time, but we'll go through and describe to you exactly how we will QA it on the test. We'll look at your product, go through your write-up, and then send you on your merry little way. All right? The errors and omissions are still posted up there on the whiteboards. Again, they're not on the test, but if you want to take pictures, it's good practice for your calculations and other things as well. You're welcome to do that. Well, let's head on out there and let's have some fun and make some suspensions, man.